Hey you guys, sorry I don't have makeup on today. When I record on the weekend, you'll see that for the most part I don't wear makeup on the weekend. During the week, I usually do. So, as you can tell, I'm recording a few minutes on the weekend. So we're going to finish up with BLS today. You will watch a video, take probably 45 minutes again, one of your periods. And then please be sure that you're reviewing your text and preparing for the test that you'll have the next day. So you're going to take your BLS written test. It will be taken on paper. I will send that to Miss Martinez so that she can administer that. And then after Labor Day, I'll actually come to school, and after the Labor Day holiday, I'll actually come to school and see you guys, and we'll get you checked off. So I'll take half a day off from here and come over and spend the day with y'all. We'll get you checked off. We'll talk about any kind of questions or any kind of issues you might be having, things you're concerned about, things you're interested in. So give me a little time with each one of you guys. And I'm looking forward to seeing you guys. I'm looking forward to seeing you guys at school. So that's kind of what goes on. Once we finish BLS, then we'll start professionalism and ethics. And when we do that, I will be recording for my class. So you'll actually see kind of what goes on in my regular classroom as far as lectures and things like that. You're also going to see that my classrooms can be a little bit chaotic at times. During some of my classes, I'm actually teaching more than one class at a time. And that's just simply because I was hoping to make this thing move a little bit so I didn't look so off-center. Anyway, what you're going to see is that sometimes I teach more than one class at a time. Now, what I'll be teaching a lot of times, sometimes it won't necessarily be in my classroom that I'm recording for you guys because I may have a couple of classes going on. While I teach medical assistant, I'm also teaching some sports medicine stuff because my block periods kind of rotate. So, anyway, you guys, I hope you're having a great week, and I'm really looking forward to seeing you guys at the week after Labor Day. And I'll get that set up with school, and we'll get you guys checked off. So it won't take long because you'll have already taken your written test, and we'll practice a little bit with the CPR mannequins, and then we'll have a unique way that we actually do this where it becomes kind of like a group activity. Two of you start it off, and then you just kind of pick up behind each other to get it done. So I will be back with professionalism for you guys tomorrow after you take your test, okay? Have a great day. Thanks, everybody. And we'll get you started. I'll get you started on BLS.
Pediatric cardiac arrest is not as common as adult cardiac arrest, but it can still occur. In adults, cardiac arrest is often cardiac related, but in children and infants, it is often due to respiratory problems. Next, we'll see an example of cardiac arrest that underscores the fact that sudden cardiac arrest can happen anywhere, at any time, to anyone.
Hi guys, have a good weekend, Sarah. I'll see you on Monday, Johnny. Harold, your mom called. She said she's going to be a few minutes late. Harold? Harold? Harold, hey. Hey, buddy, can you hear me? Nurse Helen, I need you to come to room 109. I've got an emergency. A child collapsed. Someone help! I have an emergency! Help! Someone help! I've got an emergency in here! Oh, Helen. Yes? I have a child, Harold. He collapsed. He's just lying there.
Did he fall or bump his head?
No, not that I saw.
Harold? Harold, can you hear me? Harold. Go to my office and get the AED. It's on the wall in the hallway just outside the office.
911, what's your emergency?
One of our teachers witnessed a student collapse. I'm giving CPR right now.
What's your address?
Edison Elementary, 724 North Walk Drive, room 109.
All right, I've dispatched EMS. While they're on their way, I'll need to ask you a few more questions.
Okay, I have you on speakerphone.
What's the victim's age?
5 or 6?
Is there an AED nearby?
Yes, I sent someone to get it.
Are you able to give compressions and breaths?
I'm giving compressions now, and I'll give breaths as soon as I get the pocket mask from the AED. And the AED is here now. Okay, can you hand me the pocket mask?
Yes.
And can you touch the AED?
Yes.
They're just a few blocks away, so it shouldn't be long.
Good, and that's if they take the Harding Street entrance.
Attach pads to victim's bare chest.
Do you know what the cause of the collapse was?
No, he just slumped over.
All right.
Plug in pads.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Analyzing rhythm. Do not touch the victim.
Okay, stay clear.
Shock advised. Charging. Stay clear of victim.
Clear.
Clear.
Press the shock button now. Shock delivered. Resume chest compressions.
I need you to count out loud so I can help you with your compression rate.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You're doing great. They're pulling into the school parking lot.
Four, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17.
Okay, I'll take over, okay?
Okay. Did he call our intern's help at all? No.
Okay, he's not breathing and there's no pulse. Let's continue CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5.
Dispatch, this is Unit 705. We have confirmed CPR in progress with the child.
12, 13, 14, 15. How long ago did he collapse?
About 4 or 5 minutes ago.
I started with CPR, I think it was 5 or 6
1,
cycles
2,
and 1
3,
shock.
4, 5, 6, 7. Thanks for doing all that. Good job. 12, 13, 14, 15. 1, 2.
It may be difficult to imagine a child being a victim of cardiac arrest, but it certainly happens.
Fortunately for Harold, there were teachers and staff knowledgeable in basic life support and CPR.
There are some differences with BLS for children. One is the chain of survival.
The pediatric chain of survival begins with the prevention of cardiac arrest, followed by early high-quality CPR. Next comes rapid activation of the emergency response system, followed by effective advanced life support, with the final link being integrated post-cardiac arrest care.
So now, let's see that scene again and review some of the aspects introduced.
Once again, we see a moment where it's unlikely that anybody is thinking about cardiac arrest affecting their lives.
Much less in a group this young.
When the boy collapses, the teacher isn't sure what to do. But even though she's not trained in BLS, her actions highlight one of the few important differences between BLS for adults and BLS for children.
This is one of those differences. If a rescuer witnesses a child's collapse, he or she should first leave him, as Harold's teacher does, to activate the emergency response system and get an AED or a defibrillator. However, if the rescuer does not witness the arrest and is alone, if trained, she would be correct to perform 5 cycles of CPR before leaving Harold to activate the emergency response system.
But when Helen, the school nurse, enters the room, she first examines the room for safety. Then she goes right to Harold and checks for responsiveness, breathing, and a pulse. She has the teacher retrieve the AED from outside her office, and she immediately calls to activate the emergency response system. And because no pulse is present, she starts compressions. In fact, with children and infants who have no pulse or a pulse of less than 60 with signs of poor perfusion despite adequate oxygenation, CPR should be started immediately.
As the nurse continues CPR, she also gives the dispatcher information over the phone that will be relayed to EMS already on their way. And when the teacher returns with the AED and kit, she has the teacher provide the pocket mask from the kit so that she can give breaths, because earlier breaths are a higher priority in the rescue of children than in the rescue of adults.
And it's important to note that delivery of breaths to children requires less volume and force. However, you still need to provide enough air to see the chest rise.
As the teacher is getting the AED attached, the nurse continues with compressions and breaths in the 30-2 ratio.
So here we see the shock delivered to Harold. It makes perfect sense for the school AED to have pediatric pads, though not all AEDs do. If there are no pediatric pads available, it's acceptable to use adult pads on a child or infant. Once the shock is advised and delivered, compressions are resumed. If 2 trained rescuers are available, the 1 rescuer ratio of 30 compressions to 2 breaths would switch to 15 compressions to 2 breaths.
Now the EMS team comes in and assesses the situation. The nurse continues with compressions and breaths until the EMS team is ready. Then they'll continue CPR on site until ROSC is achieved, and they'll transport Harold to the hospital.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First of all, under the American Heart Association BLS guidelines, anyone from age 1 to puberty is considered a child.
Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls.
When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you, and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's about 2 inches or 5 centimeters, and the chest must recoil completely between compressions.
Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, as we mentioned in the recap of the previous scenario, if you are a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
Another difference has to do with when to activate the emergency response system. If you do not witness the arrest and are alone, you should perform 5 cycles of CPR to ensure that the victim's brain is oxygenated before you leave the child to activate the emergency response system.
However, as we saw in the previous scenario, if the arrest is sudden and you witnessed it, leave the child, activate the emergency response system, get the AED, and then return to the child to perform CPR.
So now let's take the BLS for adults that you've learned and apply it with changes to practice BLS for children.
For this session, we will practice 2 rescuer child CPR using a 15-2 compression to vent.
Okay, you guys, you will practice this when I come and see you right after Labor Day. Now we're going to move on to infant, and then we'll do choking. But we will practice all of these.
Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the huge difference in saving a loved one.
And we never know who a victim might be, regardless of her perceived health or age.
I'd love to see Dr. Edwards today. I've been checking on her every few minutes. She has a fever and an increased rate of breathing. Okay. Oh, half an hour would be great. Okay, thanks. Bye. Chloe? 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 Chloe, can you hear me? Chloe? Chloe? Chloe, can you hear me? Hi, I have an emergency. I'm at 1819 Redview Lane in Plainfield. Okay, I'm going to put you on speaker.
What's the emergency?
My daughter, she's not breathing and no pulse.
Okay, I'm sending fire and EMS. Do you know CPR?
Yes, I just started CPR. I'm a nurse practitioner.
Do you know what happened?
My daughter, she's been sick for the last couple of days, and I was just getting ready to take her to the doctor.
And she's how old?
10 months old.
Okay, they're on their way. Can they enter the house?
Yes, the front door is open. Come on, buddy.
Good. I'll stay on the phone with you until they arrive.
Okay.
I need you to count out loud so I can help you with your rate of compressions.
Okay. 1, 2, 3, 4, 5, 17, 18, 19, 20, 21, 22, 23, 24. I'm in here. Help, please. I'm in the living room. 7, 28, 29, 30.
I'll take over compression. Get ready to give breaths. No pulse or breathing. Continue CPR.
Dispatch from truck 81.
Dispatch, go ahead.
1,
Update
2,
EMS.
3,
We have
4,
confirmed
5,
cardiac
6,
arrest on an infant.
7,
CPR
8,
in progress.
9, 10, 11, 12, 13, 14, 15.
Did you see her collapse?
No, I was on the phone and I looked away for a second
2,
and it must have just
4,
happened.
5, 6, 7, 8,
Attach
9,
pads
10,
to victim's
11,
bare
12,
chest.
13, 14, 15.
Plug in pads.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1,
Analyzing
2,
rhythm.
3,
Do
4,
not touch
5,
the victim.
6.
Clear to analyze.
No shock advised. Resume chest compressions.
Start CPR.
1, 2, 3, 4, 5, 6.
It can feel like a completely different activity to perform rescue on an infant, but essentially, the principles of performing CPR on infants less than a year old are the same as for adults. There are just a few differences, but the differences are significant.
So let's take things in the same order as we did for adult CPR. Right now, we'll talk about the skills for 1 and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse, followed by infant compressions, and then we'll go on to breaths with the bag mask device. Finally, we'll combine those for practicing 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and not breathing or only gasping, send someone to activate the emergency response system and get an AED. Or leave the infant and do it yourself. However, if the infant collapse was not witnessed and there is no response or breathing, check the brachial pulse immediately. Then, if you don't detect a pulse, perform 2 minutes of compressions and ventilations before activating emergency response.
To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, when attempting to feel the pulse, press the index and middle fingers gently on the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 beats per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest, just below the nipple line. But be careful not to press on the bottom of the breastbone. With that correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or about 1.5 inches or 4 centimeters. Deliver compressions at the rate of 100 to 120 per minute. After each compression, allow the chest to recoil completely. As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or about 1.5 inches or 4 centimeters. Allow the chest to completely recoil with each compression. And count out loud as you deliver 30 compressions.
So let's get into position to practice compressions.
Okay, you guys, y'all will, once again, all of these things you will practice with me.
As we mentioned, a majority of cardiac arrests happen at home. Just as you saw the mother give mouth-to-mouth breaths, you may need to give breaths to a family member or close friend when you're not at work.
So this section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to the victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, the air you breathe into a victim contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen to the victim.
Let's go through the steps to deliver mouth-to-mouth breaths to a victim. Start by holding the victim's airway open with a head tilt chin lift. Pinch the nose closed with your thumb and index finger, using the hand that's on the victim's forehead.
Then take a regular breath and seal your lips around the victim's mouth, creating an airtight seal. Give one breath and blow for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. And if you're unable to ventilate the victim after 2 attempts, promptly return to chest compressions.
And to reduce the risk of gastric inflation or air entering the stomach, avoid giving breaths too rapidly or with too much force and volume. Make sure you give each breath over 1 second and deliver air just until you make the victim's chest rise. In an infant, the mouth-to-mouth and nose technique is preferred. To do this, open the victim's airway with a head tilt chin lift. Place your mouth over the infant's mouth and nose to create an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift to reopen the airway and try to give a breath that makes the chest rise. If you can't cover the infant's nose and mouth with your mouth, use the mouth-to-mouth technique instead. The mouth-to-mouth technique for an infant is the same as for an adult.
Okay, that was special considerations. We're going to move on. We're going to move. It never takes me back where I think it's going to. I'm going to move on to adult choking and then infant choking, and that will be, and then we'll go wrap it up, and then we'll be done.
When food or other items block a person's airway, choking occurs. In severe airway obstructions, the victim usually will have signs of poor air exchange and breathing difficulty, such as a silent cough, an inability to speak or breathe, or cyanosis, that is, turning blue. An adult or older child may clutch the neck with both hands, making the universal choking sign.
If the victim nods that he or she is choking and cannot talk, you must act. In a standing or kneeling victim, you'll perform an abdominal thrust, often referred to as the Heimlich maneuver. Stand or kneel behind the victim and place your arms around the victim's waist. With one hand, locate the navel. Then make a fist with the other hand and place the thumb side of your fist against the victim's abdomen, just above the navel and below the breastbone. Grasp your fist with the other hand and press your fist into the victim's abdomen with a quick, forceful upward thrust. Repeat thrusts until the object is expelled from the airway or the victim becomes unresponsive.
If the victim is too large for you to wrap your arms around the waist because the victim is pregnant or overweight, for example, Wrap your arms around his or her chest and do chest thrusts instead of abdominal thrusts.
If your attempts to relieve choking in an adult or child are unsuccessful, or if the victim becomes unresponsive, send someone to activate the emergency response system. Lower the victim to the ground and begin CPR.
Perform CPR with one exception. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it. But do not perform a blind finger sweep, as this may cause the object to become lodged further back in the airway.
Choking is also a fairly common emergency among infants. The steps to relieve choking in an infant are quite different than those for older children and adults.
If you find an infant choking and he or she is responsive, first sit or kneel with the infant in your lap. Hold the infant face down and resting on your forearm with the head slightly lower than the chest. Support the head and jaw with your hand. Avoid compressing the soft tissues of the infant's throat.
Then rest your forearm on your thigh to provide support. Deliver up to 5 back slaps forcefully between the infant's shoulder blades using the heel of your hand. Deliver each slap with sufficient force to attempt to remove the foreign body.
Then, place your free hand on the infant's back, supporting the head with the palm of your hand. This will cradle the infant between your two forearms as you turn the infant over, while carefully supporting the head and neck.
Keep the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts in the same location that you perform compressions just below the nipple line over the lower half of the breastbone. Do this at the rate of about 1 per second.
Then, repeat the sequence of 5 back slaps and 5 chest thrusts until the object is removed, or until the infant becomes unresponsive. As with an adult, if a choking infant becomes unresponsive, shout for help. Then lay the infant on a hard, flat surface. You'll perform CPR, but with one exception. Each time you open the airway to give breaths, look for the object.
Once you can see the object, carefully try to remove it. Never perform a blind finger sweep. You only want to sweep for an object if you can see it. If you are alone, after about 2 minutes or 5 cycles of CPR, activate the emergency response system. We'll pause here to allow you to get into position to practice with the infant mannequins.
Okay. We go back and we're just about ready to wrap up, guys.
So we've covered a lot today. You learned the proper BLS rescue techniques of CPR and the use of an AED for all age groups, as well as how to perform in a 1 or 2 rescuer scenario. You've also learned rescue breathing and what to do for someone who is choking.
Thank you very much for your time and attention today, and especially for your commitment to learning these critical life-saving techniques. We appreciate and honor the important work you all do as healthcare professionals.
One of the cases I remember the medics called and they were bringing in a guy who was having an acute MI. And so we were ready for him.
My task was simple. I did compressions at, an appropriate rate, and I could focus on that.
It was one of the best codes I've been in. Everything moved very fast. Everybody knew what they were supposed to do. Everybody knew their role.
That's how the system is supposed to work.
As long as you're part of the team and everyone works together, you're gonna do okay.
I oftentimes show up on the worst day of people's lives, and I get the opportunity to try to make it better.
Doesn't mean you're always going to get a positive outcome. It doesn't mean that the patient is always going to recover, but it's our job to make sure that the patient gets every possible chance for that.
Okay, guys, that is it for today. Be sure that you review your text so that you'll be ready for your test tomorrow. Thanks, guys.